Diabetes affects more than 240 million people worldwide and over 2.5 million people in the UK alone. The disease can often be managed. However, if left, it can develop and lead to more serious illness. These can include diabetic retinopathy, which may result in total loss of sight. Can you imagine life without your vision?
Diabetic retinopathy is the disease of the back of the eye. Of all the people in the UK who are registered blind, 8% of these registrations are due to diabetes.
Growing up with diabetes was always quite hard. As a child, you'd go to parties and all the other children would be eating chocolate cakes, sweets, crisps, and due to the diabetes I was limited to what I could eat and how much of it I could eat. I take such responsibility over my diabetes because I've seen a lot of people with liver problems, eye problems, kidney problems, all connected due to ill control of the diabetes, and I don't want to do that. I'm 24. I don't want to end up being poorly at the age of 30 and being in hospital. When I first found out about diabetes, having eye conditions linked to it, I was part of the children's diabetic group for Grimsby, and one of the girls that was diagnosed around the same time as me was actually diagnosed with diabetic retinopathy and lost her eyesight. Not the easiest way to find out as well, because we were quite close.
When they first told me that I had diabetes, it frightened me. Initially, I kept myself pretty well. I went on a diet, cut down on fat to lower the cholesterol, kept on with my insulin, and then through a series of life events and what have you, I lost control. The more insulin I needed, the fatter I got, so I stopped using the insulin to lose weight. In retrospect, that's a crazy thing to do. If I had realised at the time that the risk of damage to my eyesight was so great, well, I would hardly have touched a carbohydrate on over the years.
In type 1 diabetics, about 40 to 45% of the patients develop retinopathy, and in type 2, about 25% of the patients develop retinopathy. Of the patients who develop retinopathy, 16% in type 1 and 6% in type 2 develop sight-threatening retinopathy, where their vision can be threatened by it.
I suddenly became very frightened because it was real. It was no longer an imagined fear or something that might happen. There was a strong case for me going blind.
The changes in the retina happen because the blood tubes which are carrying the blood, they become very leaky. The changes can be deposits of protein or fat in the layers of the retina, or development of new blood tubes which sprout because the retina isn't getting enough oxygen.
I'm getting some really good treatment, but there's still a risk that I could go blind. So I've got more laser eye surgery coming up, and it's not the kind that you see on the AccuView TV adverts. This stuff is serious. Living with the thought of going blind is affecting virtually every part of my life. I do painting, I play music, I could lose my job. Every aspect of my life is threatened by the loss of sight.
If patients try to maintain their HbA1c at 7, blood pressure at 135/80 or less, cholesterol of 5 or less, not smoke, look after their general health, take physical exercise regularly, those measures should help them to reduce the risk of retinopathy.
When I was younger, I wasn't always responsible. I used to binge on chocolate, I used to do the things that diabetics shouldn't do. I got a reality check when one of my friends actually fell really poorly with liver problems, and I decided my health wasn't worth the risk of not being sensible.
If you monitor and maintain your health, take your medication, control your diabetes, you're at much lower risk. If you do daft things like me, go off medication for periods, you're at risk of going blind. Blindness is not fun. It's scary. I may not be able to see my grandchildren grow up. That's scary for me.
If you would like further information and advice on diabetes and eye conditions, please visit www.diabetes.org.uk. www.diabetes.co.uk, www.nlg.nhs.uk.